Good evening, everyone. We want to welcome all of those of you who are tuning in via Zoom and City's YouTube channel and live to this town hall updating status of schools and reopening. Before we get started and make introductions, a couple of housekeeping points. There is interpretation that is occurring during this meeting. And this meeting is being recorded, so you'll be able to see it afterwards tomorrow on the city's website. We'll connect to that. I believe the schools as well. As at the end of the meeting, I'll remind you of this as well. As you have questions, even as you're generating them during the meeting, please use the Zoom Q&A function, or if you're on YouTube, the chat function there. We'll endeavor to ask as many questions as possible in the time that we have to roughly 7:30. And in addition, we'll try to make sure that we're spreading the questions out, and the questions that ought to have been answered via this presentation will refer you back to the presentation. But again, first of all, good evening, welcome. I do want to introduce first the presenters. The panelists will be, their names are here on this slide, but tonight you'll be hearing from my colleague, and I'll ask her to say hello now, the superintendent of schools, Ms. Mary Skipper.
Thank you, Mayor.
The Director of Health and Human Services for the City of Somerville, Mr. Doug Kress. Chief of Staff for the Somerville Public Schools, Jeff Curley. And Director of Infrastructure and Asset Management for the City of Somerville, Mr. Rich Raish. And as well, I think you'll be hearing from Amy Bantham. If I'm wrong, correct me. But anyway, we'll all be available to take questions on the entire panel that is listed here. We look forward to engaging you in this conversation. And thank you all again for joining us. So before we get into the heart of the conversation, I know a lot of you are following local guidance and avoiding trick-or-treating this year. I mean, the weather may obviously play a role in that, but that doesn't mean that you can't celebrate the holiday. If you do go out, and this is important, especially given the state of what's happening around the Commonwealth and the country with the spike in cases. But if you do go out, remember that Halloween masks don't replace safety masks, and to maintain a 6-foot distance with those around you. We strongly encourage you not to go out. For those of you looking for lower risk activities, the City of Somerville and our Arts Council are creating a virtual map of Halloween decorations and outside happenings around the city. And some of the low risk activities recommended by the CDC, which include decorating, carving pumpkins and so forth, putting together Halloween, themed scavenger hunts for your kids, hiding treats around your house, and etc. But you know, I get it. This is one of my favorite times. My youngest still likes to go out, and I like to go out with them. And it's one of the best times to meet you, get reconnected with neighbors and friends and people around the city. But this is not a time to gather. As much as we want to celebrate Halloween and other things, as much as we're done with COVID, I've said before and I'll say it again tonight, it is not done with us. But as we begin our presentation, I do want to reiterate the importance and state, and you'll hear this from myself and Superintendent Skipper, building a safe and sustainable reopening of our schools. And we mentioned this last month. We have seen many school districts locally and across the nation open up their classrooms, but only to return to remote education when outbreaks occur. And yes, it is true that Somerville's timetable for in-person education is later than other schools in the metro area. And it is true, and yes, and we appreciate and acutely aware that our parents, you are shouldering a heavy burden in dealing with the hardships of the pandemic and making sure our students, your kids, are ready for schoolwork. I understand. I still have 2 sons in the Somerville Public Schools, and I am acutely aware as a parent, and also from hearing from many friends and neighbors and many of you, how difficult it is. But we are implementing a plan that we think will best keep your kids and our students safe, our dedicated teaching staff safe, the entire support staff that share the school building safe. And we are also establishing protocols that will prevent the spread, help prevent or reduce the risk of the spread of the virus in our classrooms before they force the schools to close again. And that's what we mean by a sustainable opening. Because as difficult as this period is for many families, what we do not want to do is add to the trauma of uncertainty to students and families with this constant teetering back and forth of openings and closing. So on behalf of everyone you'll hear from tonight, and myself personally, we thank you. I thank you for your patience and your flexibility. And I admire your resiliency and determination, and we will continue to dedicate every resource, every bit of our public resources necessary towards supporting you and your families and through these difficult times. At this time, I do want to recognize and hand up this part of the presentation off to the Superintendent of the Somerville Public Schools, Ms. Mary Skipper. Madam Superintendent.
Great, thank you, Mr. Mayor. And so again, just to reiterate what the mayor said, a big thank you to the families. This has certainly been an unusual start to the school year, and we are all trying to work together, but have needed the support of families to do this. Family engagement more than ever has been critical, and it's just amazing to me how patient and supportive families have been in the work with our educators. It also has just been such a good collaborative effort on the part of our staff. Our staff has worked tirelessly from the emergency closure through the summer in terms of planning and training, all the way into the fall, working with us, our unions, to really try to come up with a remote learning plan that was rigorous, adhered to the standards for the state, but really respected the individual differences of students and their needs. And so, I think that we've made the best possible scenario we can from remote learning. Our attendance right now is mid to high 90s in all of our schools. And there's just a continued, positive engagement on the part of the students, showing up, being happy to be there, to see their teachers, and their teachers likewise with their students. So, really, whether it's synchronous or asynchronous, we are really striving to do the best possible remote learning plan we can, and we will bring that same effort collaboratively together with our unions to do that with our hybrid learning model as well. Just another big compliment is to our recreation staff, Jill Latham and her leadership, Rosanna Parabello and all of the community school staff. A big piece of this is knowing that we need to take advantage of our outside spaces as much as we can. We have over 1,000 students, particularly in our youngest grades, who are coming in from the 12:30 to 2:30 block or in the after school programming to really see one another and in a socially distanced, safe way, be able to participate in activities with each other and get that social emotional work in the bank. And so, we really thank everyone, including our building leaders, who have helped to organize that. Rec has been unbelievable with its staff, and our high school students who have helped with it as well, and are part of the recreation staff. We are using our outdoor tents. If you are around the schools and you go out into the schools, you'll see often that even in the rain and the inclement weather, even in the cold, we have students coming in, we have faculty coming in to be able to work in whatever capacity they can using the outdoor spaces. And we will continue to do that for as long as we're able to do that with the weather. And then finally, to our food staff, Lauren Mancini and all of her staff that have just from the closure back in March, made it a priority to make sure our families are not food insecure. We average 3,000 to 4,000 grab and go breakfasts and lunches each day. And that takes an incredible lift and a lot of work on the food staff's part, but they do it, whether it's holidays, whether it's weekends, they're there to make sure that our families have what they need. So just a really, it's a wonderful example of how the Ville in Somerville really has taken this pandemic and in a very collaborative way, brought out the best in one another. So just a huge thanks to that as we move forward to this next important step toward getting our students back in person in the phased hybrid.
Thanks, Superintendent, and passing back to you shortly again. As we discussed the conditions that will impact our ability to move into phases of reopening. So you've heard me say this before and describe this, but you should think of them as factors external to the school, such as community transmission, new guidance from the CDC, and the availability of human and material resources, and those internal factors over which we obviously have more control. They're described here, we described them before, building ventilation, COVID-19 surveillance testing, which we unveiled today, and we'll talk about this evening, and maintaining classroom bubbles. So we're gonna start up as you usually done to do the external factors first. But beforehand, I do wanna provide this information because many of you asked how we are making our decisions and what informs them or who informs it, who is advising us. First, I do wanna be clear that, and I think we all know this is a complex crisis, and I will fully admit we did not have a pandemic response plan here in City Hall. I don't think any community did. Hopefully history teaches us better as a society and as a public institution to be even more prepared. Again, this is complex, and the scientific consensus and emerging best practices are continually advancing and evolving. So our decisions are based not just on one source, such as expert advisors, but rather on really a constellation of inputs, and that include experts and constant review of evolving research, the monitoring of new information, whether it's national reporting or information from nearby local school districts, or the lessons learned across the nation and around the world, or collaboration with other officials, or the review of official guidance from not just the CDC and US-based agencies, again, but from other national governments and agencies, and the evaluation of emerging best practices and more. As for the experts, we have been and are extremely fortunate to be located in an area of the country or some in the world where some of the most respected national and international experts are located at our institutions and universities. Some of them actually live here in Somerville. At our behest, a wide array of these practitioners have been providing insights and real-time analysis and perspectives to the coalition of regional municipalities that Somerville convened to meet weekly to coordinate the regional response, going back to the beginning of this crisis. Others have been specifically advising Somerville in a direct manner. They have helped us process the continual flow of new information. They've informed our policy making, and they've shared deep and critical insights at every step of the crisis. Now, they've done this, and we're grateful, for free, in between consulting in some cases for organizations such as the WHO, which is the World Health Organization, or the Center for Disease Control, CDC, or our own governor. Due to the failure of the White House response, states, cities, and towns, too many of them have been flying blind. In Somerville, we are fortunate to have not be flying blind. But I do want to add that we share this partial list for transparency because some of you have asked, and that's legitimate. But I also do want to caution you, after we named respectfully, after we named a few experts last time, some parents contacted them to demand information on their role in our response. That I would just submit to you, that's just not helpful, and it was not welcome by them. So again, these experts are supporting our communities, our schools, they're supporting our safety and our emergency response for free. They have been invaluable to us in cities and towns across the region, and they don't make our policy decisions, but they do provide critical help in informing them. So having anyone, any individual, any parent to convene with these very busy and esteemed and in-demand experts may drive them away. And I assure you that will only do harm to our local and regional response. So respectfully, I ask that, and I understand it may be frustrating, maybe you don't get the answer quick enough for us, and we apologize, we're doing the best we can. To submit your questions or concerns or comments to us, and we will do the best to answer them. And I appreciate that, and please, because we need every resource we can have, and resources, if you haven't noticed, the federal government hasn't stepped up to provide us the financial resources we need to figure this out. We've been left to do it on our own. We'll go next slide. To understand, going back directly to the schools, to understand the public schools projected timeline, again, let's go back to the external factors influencing the decision to move to later phases of in-person instruction. A safe reopening really depends, and many of you asked about what are the indicators we're looking at? Is there any one or any two? Well, again, this is a complex problem. There is no magic bullet here to determine what to do or when to do it. A safe reopening depends on a constellation, again, of related factors and data. And anyone who says there is one magic number or trigger point is just really putting convenience over safety, which is why we pushed hard and disagree with the Commonwealth's approach of using a color-coded map. And we'll talk about that. You know, it was at the beginning when they said you should be remote if you have, if you're in a red or high risk community, or the Commission of Testi, Department of Early and Secondary Education, flipping on that and saying, well, you shouldn't be, even if you're red and you should, and we said before you should be remote, you shouldn't be remote unless you know for sure cases are coming out of your school. Well, you really wouldn't know that unless you're doing the testing we're going to talk about today or something like that. Again, but a particular percent positivity rate has a different implications if it's trending up or if it's trending down. And it may be limited in capturing active community transmission if we don't have sufficient testing and contact tracing. So these numbers and projections, this data changes regularly, weekly, and when they do, they have ripple effects across the region. Next slide. A little bit about the status of things today, and I have an update that just came out literally minutes ago. I know how much each of you has sacrificed, and we thank you to keep your neighborhood safe and help our community respond to COVID. And together, and I've said this before, and I thank you, and I commend the governor and the Commonwealth and everyone here to do what we had to do to maintain the stability of our healthcare system, to flatten the curve, which saved lives. But we paid for it, not just in inconvenience, but in blood. 45 members of our community have perished, more than 9,700 in the Commonwealth have died, and hundreds of thousands in this country have died. And this virus, we might be done with it, folks. It's not done with us. It continues to be with us, make people ill, and people will continue to die. So, but I've seen you following science-based measures to slow the spread of COVID, and it shows that we are a community that cares. I've seen you stand up for one another and to look after one another and participate in these meetings, and that's really important. The rate of infections around the country are on the rise, and Massachusetts is no different. You know, we are seeing positive cases at their highest level since early in May. I don't know what the case count was today for Massachusetts. I believe it was a 6th day over 1,000. Massachusetts, we just learned this minutes ago, their incident rate is 11.8 right now. 11.8, or up over 2 points, I believe. Somerville has had trickled into the red, and we're now, we're informed today, we were at 8.5, we're now at 7.5 compared to 100,000 daily incidences in the last 14 days. Percent positivity is 0.38. Again, well, that's fine. We might come back to the yellow. You can rest assured we're going to teeter-totter back and forth here because of the approach the Commonwealth's taken. But, you know, we have seen screening at Deer Island of wastewater suggests that we may only be seeing the tip of the iceberg as traces of coronavirus has spiked this past week. Again, in Somerville, we still have about 160 active cases. So we are crossing the threshold of the doorway of the resurgence, and we're about to experience some very tough times moving ahead, which really requires us to double down on our vigilance as individuals, as institutions, and as a society. I do want to talk a little bit about what I mentioned about Testi. Move on to the next slide. And moving their posts. This color map, my understanding, has drastically changed towards the red. We were at 77 communities before this meeting. We might be around 129 if I'm counting correctly. We'll get that final count for you. And this should be of no surprise because this town by town approach, relying on 351 different approaches and about 300 school districts, makes no sense. We are the most densely populated community in New England, live in one of the most densely populated regions. So, you know, and just think about it. Our residents travel on the same transit systems. Workers work in the same industries or business districts. We're a mobile society. Our teachers and staff are drawn from surrounding communities. And this virus knows no boundaries. It certainly knows no borders. So, you know, we heard Commissioner Riley said during a joint committee on education hearing on Tuesday that schools are encouraged to remain open even if their community is red. Seriously? How do we know? And we'll talk about this. So what do we do if we're red and do we stay in school? We'll talk about how surveillance testing will help us determine, is there in fact origination of cases, positive cases coming at our school buildings? How is it impacting our classrooms and individual buildings? He also said such districts offering in-person or hybrid learning models should continue to remain open until there is any evidence that there is a transmission happening in school. Ladies and gentlemen, I just want to say I wrote about this. We've been handed a hot mess as one school district, like every other school district in Massachusetts. This is not a plan. So we need to institute the systems to create the safe environments from a building perspective, from a testing perspective, from an operational perspective, so we can get the learning we need for our kids done safely, and that our teachers and staff are safe, and that we don't have any consequential spread to the rest of our community. We just can't afford it. Moving on to the next slides. You know, since the beginning, this virus has shown no slowdown. It showed some slowdown, but no stoppage, let's just say. It moves at different paces from March as we move on to the other months, and you'll see the slide, and you'll see this heat map. It's been unrelenting and harsh, particularly to our most vulnerable populations and parts of the city. Folks who suffer from certain inequities and suffer from poor health outcomes, who are working the frontline jobs to provide the services for our conveniences, do not have the luxury of working white-collar jobs and working virtually. I just want to put this slide, put this information up to let you know that, again, the virus is not only here, it's being particularly harsh amongst the people. We all cry out collectively to say we need to fight for their collective justice. When we want to tackle structural racism and equity in our community, this right here is what we need to keep in mind. This pandemic has put a glaring spotlight on so many of those injustices. Who has access to healthcare and better health outcomes, to better paying jobs, to transit, to all the opportunities to keep themselves and their families safe. And I know you know that as a community, because that's what makes me proud to live here, is because people look out for one another and they fight for what is right, and it's part of our value system. Moving on to the indicator piece, we have shown this table at our town hall last month, and it represents 3 indicators in the status of the virus in Somerville. And I just mentioned before, some things have changed. We're now at 7.5 at the rate per 100,000. We were 8.5, just changed minutes ago, and our positivity rate is 0.38%. So we look at positive case rates, the percent positive amongst all tests carried out, and importantly for our students and staff as we transition to an in-person learning, how we need to monitor how quickly testing results are being turned around. Here you can see the levels showing high risk, moderate risk, and lower risk. And I wanted to emphasize that lower risk is still a risk. And we have to put it into context of where we live, in the most densely populated community in New England. And when we think about our schools, we have to put it in the context of schools as well. So if we look, for example, so these current indicators for the city, we see the complications and the relying on only one metric to base our decisions on. And while the percentage of positive in Somerville falls in the lower risk range, now 0.38, not 0.39, the rate per 100,000 again is still high, and move down slightly. And again, we'll be going back and forth. This is why my staff and I have always stressed the importance of looking at the constellation of indicators and community exigencies to make our decisions. Testi, the Department of Early and Secondary Education, had originally had a blunt tool to manage our risk in schools. Now it appears they have no tool. So again, we're on our own to figure it out moving forward. I know we've heard this many times, but there's a number of cases around the state are on the rise. It bears repeating. And I ask you, I know it's been hard. I'm suffering from pandemic fatigue like you, but we all have to remember to follow the basic steps and utilize the tools we do have. Exercise and proper hygiene, washing our hands, wearing a face covering and wearing it properly, cover your nose and mouth, maintaining a 6 foot distance between yourself and others when you go out. This is important because while there is no one point of direct origin of cases we see here, we've identified so far in Somerville, what we've seen from evidence on a broad spectrum is case transmission happening in familial or communal settings, getting together with your friends, not wearing your face mask, going out for a drink or dinner, or in family settings. So when Dr. Fauci advises us, hey, Thanksgiving, you may want to hold off on that family gathering, listen to him. So, stay at home if you're not feeling well. And if you do get sick, please cooperate with your local contact tracers. We're seeing this especially around youth sports around the Commonwealth. Youth activities, various sports and youth activities, when cases are popping up and contact tracers reach out, people are not cooperating. So if we want to be able to live in this new normal with some level of activity that gives us relief and some soothing of our mental health and duress, the duress we're going under our mental health, then we need to do all the things, meet our responsibility as individuals. So please remember to do that, because we do have those tools at our disposal. Moving on. Again, the contact tracing we mentioned, this is really important to understand. To provide information. They're never going to ask you for personal information like your social security number, but it's really important. Contact tracing gives us information real time. It allows us gives us one of the best tools we have, in addition to testing, to strategically contain any potential outbreak in our schools or in our community. Next slide. So I'm going to transition now. The other thing we do have, in addition to the other tools that aren't technical, is testing. The one thing that every school district should have is the ability to surveillance test. So this is the other factors internal to the schools and the community that we have more control of. Doug Kress, the Director of Health and Human Services, will explain the collaborative effort the district and the city have undertaken to minimize the COVID-19 spreading in our classrooms. As we get closer to welcoming students back to the classroom, we'll be stepping out our outreach efforts to parents to make sure that each of you knows and practices the standards that we have developed to keep you and your students safe, that provide a safe working environment for our teachers and staff. Again, I want to thank Doug Kress and his department for their efforts in the community and the school. I'm going to hand it off to Doug. Doug?
Thank you, Mayor. I appreciate everything you've done for us, and parents, thank you for joining us tonight. I know this is a critical and important message for all of you, so we do want to thank you for attending tonight. We know that students, parents, and staff, they are all eager to get back into school. And as the mayor stated, our goal is really to make sure that we are coming back and that school is a place when we return, a safe and sustainable environment for both our students and our staff. So to do so, we've done a lot of research, and what research is telling us really is the idea that we not only need to have all of those practices we were talking about for the environmental areas of making sure you're wearing your mask, covering both your nose and your mouth, but also the 6-foot distance. We also know that it's critical for two other things. First, this year, more than ever, we want to make sure people are covered with the seasonal flu vaccine. We can't go halfway. We know the governor has already made the announcement of students. We need to ensure that everybody in our community gets that vaccine. So please step up to the plate, do it for your students, do it for your neighbors, do it for our community, and get the vaccine if you're able to do so. We also know around COVID-19, the other important area that we have to think about and continue to hear is testing, testing, testing. So that's why we have put together a robust system that we believe is the best way to move us forward. And to do so, the Board of Health is actively working to put together a flu vaccine and a COVID-19 testing protocol and an order for all students and staff. So part of that is adopting a protocol that will adapt as schools reopen, and to plan for students and staff in close contacts to have readily available access to COVID-19 testing on a routine basis. We keep hearing that over and over again, and we are stepping up to the plate. Next slide, please. So I just want to take it back one step and talk a little bit more about the flu vaccine. Please make a plan to make sure that you and your students are getting the seasonal flu vaccine this year. It's an important one because we want to maintain the stability of our healthcare systems and not overburden it, because we also know that young people and adults, if they get this flu, there's a very good chance that they can continue on and possibly also burden our healthcare system. If you layer that on top of any of the areas around COVID-19, we are going to become challenged again, and we don't want to see that happen. So what have we done? We've done a variety of things within the schools. We have vaccine clinics that are coming up. We want to make sure that that is available to our students. We also want to remind you, and parents, please listen carefully. Please make sure that your healthcare records are up to date within your schools. Contact your school nurse, contact your physicians, your primary care providers to make sure that you have your physicals, as well as all other things that we need in our nurse's office so that we can open up schools and students are able to return. That includes any doctor's orders, updating your vaccines, updating your physicals, depending upon which age you're at. You should have already received a letter from our nurses. Please make sure you follow that information and get the information that we need so that we are able to have this done before we go back into school. Again, make that plan ahead of time, and we would really appreciate that. So what we also talked about in the next slide, we're going to be talking a little bit about why do we want to do a routine testing in our schools? Well, we want to be able to identify COVID positive individuals who are asymptomatic as well as pre-symptomatic, so we can prevent the spread of this virus in our schools, but also in our community. We want to be able to rule out anybody who may be positive or who are presenting COVID-19 symptoms. This will allow us to really identify who is there, but also if they are positive and get through the isolation period, are able to return to school. We also know it's important to look at a baseline and look at the frequency of our testing, but that's only part of it. We want to be able to use that to really effectively measure how good the 6-foot distancing protocols and other types of protocols we put into place, including the wearing your face covering, covering your nose and your mouth, to help us inform decisions moving forward. Next slide. So when we look at this, try to make this a graphic for us. If you have a contagious person, if we're able to identify that individual and cut them off from spreading that virus, look at how many people we're able to prevent from getting other people infected. However, if that does happen and the contagion goes into somebody before we're able to capture them and they don't have any symptoms yet, but are still having that virus, if we slow that down because we're able to identify and do that early detection, we can quarantine them so that we make sure that the virus doesn't go over into the areas of non-infection, a critical point for that. Next slide, please. So our approach, we were very, very careful and did a lot of research around the ideas of what are the approaches that we want to take when we're identifying a testing partner. So in that, we really looked at a variety of things. So our criteria includes how flexible in the flexibility of both the partner, but also us as a city and school. We have to be flexible so that we're able to change because we know the science is changing on a daily basis. New partners may appear, new tests may be becoming available to us. So we need to be flexible within there. We also know that it has to be sustainable, and that's being able to maintain our logistics of where we're testing, how we're testing, but also the cost over time. Of course, it has to be acceptable for our students and staff and feel comfortable when they're taking the test. So we're going for them, we are supporting and recommending and moving forward with a non-invasive as possible swab test that is very simple to do. It's a simple size of a Q-tip that's right up inside of the bottom of the nose, and it's a quick turn on each nostril in order to do the test. We're going to be trying some other ones as well, such as a saliva test for a baseline for our staff. We also want to make sure that these are reliable tests. We want to have the confidence with the results that we're getting. So obviously we want to make sure that they are very specific for this virus and making sure that we're identifying what we need to. And that's why we're looking at the PCR test. We also want to make sure that the partner is able to test our youngest members of our community. So we want to make sure that they're able to help us and work with our student population. And then finally, we want to make sure that the test results are back within 24 hours of receipt of those samples themselves. From here, I want to hand this over to Amy Bantham, Dr. Amy Bantham, because she actually did much of this research and helped us identify who it is that we have picked as our tester. So Amy, can I hand this to you?
Yes, thank you, Doug. Yeah, we wanted to share a little bit about the research that went into the decision and the protocol that we're outlining tonight. And by we, I mean the testing advisory group. And we spent a lot of time and leveraged the wonderful capacity of the K-12 testing collaborative. Somerville is a part of it, with a number of other cities and towns. And we were able to leverage this group to understand who the potential testing partners are and to interview each of the potential testing partners, as well as the wraparound service provider. And by that, I mean those who are administering and collecting the samples, the swabbers, for example. And we were also able to speak with many cities and towns who are actually using these testing partners, so we could understand what our best practices, what our lessons learned. And so we wanted to present the two testing partners that we'll be working with. One is Ginkgo Bioworks. It is a free one-time donation, and it's for staff baseline testing only. So it's provided by Ginkgo Bioworks, and it's coordinated by Immune Observatory. The agreement is actually between the district and Ginkgo Bioworks for this in-kind donation, and the availability is sometime in November. The city would administer the test. As Doug mentioned, it is a saliva test, so the baseline staff test will be the saliva test. All of the tests that we looked at were PCR with the highest sensitivity and specificity. Here, ability to test minors is no, only because this is for staff, and that is part of the legal agreement and what is allowed with this donation. Rapid results, very important. This is the saliva test, the Rutgers test. So the samples actually go to be processed in a lab in New Jersey, but again, within the 24 to 72-hour window. The other testing partner, and I know that there was a lot of media coverage around the press conference with the Tufts University, Broad, and Cataldo partnership, which came out today, and we'll be talking more about that tonight. We are able to leverage a strong ongoing partnership with Tufts and their generosity for sharing their lab capacity with the Broad, and for cost sharing around individual tests between now and the end of this year. The individual testing is the anterior nasal. We'll talk a little bit more about that. We'll be transitioning to pool testing. Again, PCR, the gold standard of testing. Ability to do the students as well, which is why it will be baseline students and ongoing students and staff, and very, very quick turnaround times within 24 hours. Next slide, please. As I mentioned, Tufts, Broad, and Cataldo are our testing partners, and really looking at the baseline testing for the students and ongoing screening of students and staff beginning November 30th and December 1st with the high needs special education students, the ELL levels 1 and 2, K through 8, and grades pre-K and K. Now, I mentioned we'll be starting with individual testing. It's individual asymptomatic screening testing with the intention to transition to pooled testing. Tufts has undertaken a pooled testing pilot with staff in Medford schools. They have validated their pool testing protocol with pools up through 8 and potentially up until 12. Next slide, please. So this is an important point, having held one of my 8-year-old's hands as she had the brain tickler done, and then separately a few days later had the anterior nasal swab, which is not the brain tickler. She termed it just merely the tickler. It was slightly ticklish, minimally invasive, as Doug mentioned, the lower part of the nostril. It can be self-administered in older students, and the trained health staff, and this is where Cataldo, our longtime partner around community testing, comes in and would administer to the younger students. It's very much the preferred testing method for students and staff, and to underscore here that COVID testing will be free. Next slide.
There was a question regarding what is a PCR test?
Sure. Yeah, the PCR test is really called the gold standard in testing, and it has the highest sensitivity and specificity, and it's Again, as opposed to antigen testing, these rapid, less sensitive, less specific tests. And so we are able to do the PCR testing. And what the pooling does is it really allows for this highly sensitive test, efficient, reliable, and with pooling, it's extremely cost effective. So at a fraction of the price. So pooled testing can actually be, these samples can be pooled at the collection site, or they can be pooled at the lab. And what we're talking about here is pooling at the collection site. So 8 students would be swabbed, they would be put in this central repository, and then would be processed. And so with individual screening, we're able to get to the individual result. But with pooled surveillance, what we're really, we're understanding what a pool or a cohort or a classroom, and there would need to be confirmation of positive pools. So if pool 2 had a positive in it, then there would be coordination with HHS, and we would move into the next phase, which would be the individual testing and the individual reporting. Next slide, please. So how would individual tests be communicated? So no news is good news when it comes to negative tests. Positive tests would be communicated through HHS and in coordination with the HHS staff, the school nurses. And again, every test that we looked at, it was very important to have this rapid, not rapid antigen, but rapid turnaround, this under 24 hours. And the Broad has consistently shown its ability to provide that rapid turnaround. Next slide, please. Now looking at how will pooled test results be communicated when we transition to pooled testing. Again, with negative, no news is good news. With positive, as I mentioned, there would then need to be an additional testing to get down from the pool of 8, the pool of 12, down to the individual results. And that's where HHS and Doug's staff would come in. Next slide, please. And this is where I'll hand it off to Doug, who will talk about how will any positive cases be handled.
Great, thanks, Amy. I think that's a great way to explain all those. And so people know the PCR test really is looking for a genetic, the virus genetic material. And that's what they're actually looking for when we run a PCR test, so that we can be very specific with which virus we are looking for. So we want to talk a little bit about how will the positive cases be handled. As Amy mentioned, we're going to be following up with the individuals who do test positive, and we'll be contacting you. And what will happen is they will be enrolled in our contact tracing program. In that, we will be following up with the individual to make sure that we understand a little bit about, where are they at, making sure they're able to isolate, help us identify who they may have had close contact with. I remind us that the close contact is an individual who is within 6 foot of another individual, of a person who tested positive for more than 15 minutes. We're going to go over this a little bit later, but that 15 minutes now is cumulative over a 24-hour period. So we'll also look at that, and the traces will coordinate with the school district to make sure that we have information both to the schools and with the schools, as well as the school nurses. The school nurses are part of our staff over here at HHS, so we already have a lot of that communication in place. And we've also been lucky enough to have our school nurses work with us this spring on contact tracing, so they're very familiar with the process that we are looking at. So the nurses will help coordinate and working and contacting the school about the close contacts within the school, and also some of the students as well. The nurses are also, because they have great relationships with many of the families, they're also going to be there to provide information for the family, additional information about the student return, to make sure that they're not coming back too soon, but when they come back that they are healthy. And they're also there to answer a variety of questions. The schools are going to help coordinate the cleaning, the staffing issues that may pop up, the schoolwork for positive individuals to make sure that they have that information, all of the schoolwork still set aside. And then also we're going to work with the individual to identify who the household contacts are and work with them to be tested, whether that be through our community testing programs, their primary care provider, or if this works out well, we are hoping for home visiting as well. Now for the pool testing, it's a little bit different because there's an extra step in there, because we do have to identify once a pool does come back as a positive pool, all the negative pools are already clear and free to ready to go. But a positive pool, that means that somebody within that pool has tested positive. So we need to coordinate that retesting of the individual to find out who that is. Once we identify who the positive person is, they then will go back to the individual positive test protocol that we just went over. One thing I want to remind us though, that if there is a positive pool, everybody in that pool will be required to quarantine until we identify the individual who is positive. That should take less than 24 hours for us to get that information back and be able to move us forward. Next slide. I think it's important to make sure that people understand the difference between quarantine and isolation. Quarantine is what we use when someone is a close contact to an individual who tests positive. So that means they need to quarantine themselves for 14 days after their last potential exposure. Now, I want to remind us that the negative test result, if they do go and get tested, a negative test does not get them out of the quarantine. They must still stay in that quarantine because they were exposed. And we know the timing of some of this, that it could take up to 14 days for that virus to appear, have symptoms, and shed that virus. That's why we have a 14-day period with our quarantine. Now for isolation, if somebody does test positive, that individual is asked to isolate for 10 days after they test positive, and they have to do that without symptoms. And we also want to make sure for our students that before they come back, they also do not have a fever for more than 24 hours, and that is not assisted with any types of medication. Let me remind you, the isolation period starts after symptoms developed or a positive test result. Next slide, please. I talked about this earlier and said I want to define this a little bit more because I want to make sure that we're clear on this. The old definition for CDC was for close contact, 15 minutes. If you were within 6 feet of somebody within 15 minutes, and that's usually for consecutive. Today, it is actually redefined that you would be a close contact is identified as somebody who's within 6 feet of an infected individual for a cumulative total of 15 minutes over a period of 24 hours or more. So what are we going to offer? Will we offer COVID-19 testing for our close contacts? The answer is yes. Somerville residents will be encouraged to either use our community testing, and we will help them set that information up and work with them to get those appointments. We can usually get everybody in within 24 hours because we do have those openings, and we will expand the clinic if need be. We're also exploring the option of offering home visits for our individuals who are, for our household contact individuals as well. For non-residents, we're encouraging them to look at Stop the Spread MA, which are sites across the Commonwealth that are available for people. And many of those are available on the same day basis as well. Both of the links are listed here today as well. So our school nurses are also preparing for a safe transition as well. They've been working hard at putting together information that's clear for our parents, for our staff, and for our students. We also know that they're going to have that ongoing communication with our administration and the health department to convey any concerns or questions they have or individuals have. They're also going to help us with our close contact tracing. And we want to remind you that this is really an important thing, is that confidentiality will remain an important policy for all of us, and that we're going to follow our DPH guidelines as well. With that, I'm ready to hand this back over to the mayor to talk a little bit about other factors that we're talking about.
Thanks, Dr. Bantham. So right now we're going to transition Into the other internal factors we have control of, and that's on the operational, the sort of safety standard side. And I'll hand off to Chief of Staff of the Somerville Public Schools, Jeff Curley.
Thank you, Mayor. Echoing a theme of this presentation, again, our top priority here for return is the safety and well-being of our students, staff, and families. We've been working, the city and the district, over the summer and into the fall to put in place significant health and safety protections. As our students return, our schools are going to look different from how they looked 7 or 8 months ago. We've been guided by medical, scientific experts, the latest research on environmental safety to help us develop this layered approach to health and safety of our schools. So I know we've covered some of these things. I won't go through them in detail, but these are the measures that are already in place. The things with check marks indicate work that has been done. And since we're going to talk in more detail about ventilation, I just want to cover a couple of the key things. So our schools are set up right now for 6 feet physical distancing for all individuals. Our principals and school leaders have worked very hard to lay out signage and flow of students to make sure excess furniture and things are cleared out of the buildings. So students will be coming back to, and staff will be coming back to safe space. We've also worked very closely with DPW on a checklist and new procedures for enhanced disinfecting techniques for classrooms and all school spaces. Next slide, please. Thanks. So the district with the city has purchased cloth and medical grade masks. We've done training with all of our staff on proper mask wearing techniques. That will continue as students come back. We'll continue to reinforce that. Our food sites are giving out masks across the city to anybody in need in the community. And food service will continue to operate both remote food sites and food distribution and in-person food distribution as students return. Next slide. This just talks about the work that we've done guided by CDC and other experts to make sure that our custodial staff are cleaning and sanitizing things on a regular basis to help mitigate any potential spread. And that work is ready to go as soon as students come back. And finally, the schools, as I mentioned, are going to look a little bit different as students and staff return. So these are a couple of images from the Argenziano School where we're showing classroom spacing, we're showing the signage that'll be there as students return. And we know this will be different, it'll take some adjusting like everything else, but we want to make sure this is part of the approach to keep everyone environmentally safe as they return. So now I'll turn it back over to the mayor, talk a little bit more about the HVAC work. Thank you.
Thanks, Jeff. The next internal factor on the wall in waiting anticipation includes building mitigation and ventilation. As much as we don't know about, we continue to learn about this pathogen. Scientists globally have come to broad consensus that aerosol transmission via the air is perhaps the greatest risk factor, especially in poorly ventilated indoor spaces. So this consensus began to emerge early in the pandemic, and the WHO, the World Health Organization, joined that consensus in July. And aerosols have been shown to travel more than 6 feet and to hang in the air. This is why face coverings matter. This is why addressing our ventilation systems matter. And this is why our expert advisors, who just happen to be world-class scientists who we are lucky to have in this area, have urged us to address air quality in the schools, to keep our students, to keep our staff and community safer. And you've heard me say this before, and collectively, we will not roll the dice with our students and skip this step just because the state or Testi did not require us to address this significant factor. We are working through a plan to get our air quality to meet the safety standards, which we'll review, we've set out for ourselves. And I will say, as those plans, and Rich Raish, the Director of Infrastructure Management, will be taking over on this presentation at this point, as those plans and work plans, beginning with Group 1 next week, become finalized or reach the next phase, we will be publishing them, put them out for public review as well, and so forth for Group 2 and Group 3 as we move forward. But I'll pass it on to Rich Raish to provide more detail on how we are aiming to ensure that every child and teacher and staff member, or even visitor to our school, is breathing safer air. Rich?
Thank you, Mayor. So since June, we've been methodically working through the process of evaluating our buildings and what can be done to lower the risk of transmission in them. We've been working at a very quick pace, but making sure that we're always thorough in all of these evaluations. And it has been a series of stage gates. It's sort of an iterative process, and we get more detail on systems as we identify what needs to be done and what can be done in each one of the buildings, each one of the spaces. So beginning in June, we first identified the risk in each of the spaces and each of the buildings through evaluating what the systems are in the buildings relative to handling air, both in terms of exchanging fresh air into spaces and filtering air that's within those spaces. We also looked at different methods to be able to reduce the risk, how the existing building systems could be improved to reduce that risk, with an eye on achieving thresholds. There aren't specific government issued thresholds for each of the spaces. And we brought on an outside consultant, Fitzmyer Tochi, who actually specializes in healthcare and hospital areas. And not all spaces are equal. Nurses' stations, for example, need a higher threshold than classrooms, which need a higher threshold than areas that don't have a lot of people in them for extended periods of time. Through this process, we were able to identify both the existing risk and the existing potential, sort of the idealized potential in each one of these buildings, which allowed us to put schools into two buckets. One, schools buildings that we knew we could not do quick interventions to get them up to our safety standards, which again, it varies by the use in the area, but just a rule of thumb to think about is air exchange of 4 times an hour for fresh air and filtering that air 6 times an hour, sort of on average for different spaces. Some of our buildings we identified we were not going to be able to do that, so we put those buildings off to the side. The buildings that we identified had that potential. We went back through and started to put a little bit more thought into how we would actually implement that in each one of those spaces. It's often said that the devil is in the details. That's where we started sort of figuring out what can and can't be done in these spaces, which again, given how quick, in estimating how quickly we could implement those in each one of those spaces, we're able to triage the buildings, ones that we could deliver early, ones we could deliver late. And working in partnership with Somerville Public Schools, saying how could we utilize these spaces best, doing a phased implementation and phased opening plan. So if we go to the next slide, because we had a lot of spaces to evaluate, we did this on a numeric scale so that we could track each one of these spaces. And did it on a scoring of a 1 to 4. A score of 4 is a high risk, an area with little to no handling, which would then allow those aerosols to concentrate, which would increase the risk of transmission. A score of 1 would be an idealized situation where we're turning over the air, we're filtering the air. That's the absolute lowest risk. And then a score in the 2s is a moderate risk where we have some air handling, but not quite to the levels that we want to prevent aerosol spread. So we established our threshold for occupying a space or occupying a building in that 1 category, the 1 to 1.9. So if we move to the next slide, we had 3 buildings in the Somerville Public School system that currently were rated as high risk and also looked at the potential for upgrading those systems on a fast track and determined that any interventions we would put would only get it into the moderate risk category. And it's important to note that this was on the first flush, right? Sort of the idealized what could be done to those systems. Even before you get into the devil in the details kind of analysis that would reduce those interventions. So we decided that anything that fell into the twos would always be moderate risk. There would be no way for us to improve upon that, as different interventions sort of became eliminated from consideration, those would only fall further into the moderate risk. So we decided to take out of consideration the Brown, the Edgerly, and the existing high school. Of course, the existing high school was not that high value property because we're building a new high school and are looking to replace that immediately. So go to the next slide. That then led us to the cooperation with Somerville Public Schools on, how can we improve these buildings and how can those buildings be used? And obviously with the high school, the Edgerly, which is currently housing some CTE, some career technical education programs, and Next Wave Full Circle, and the Brown School, those would obviously be offline. And so the students that would normally go there would need to go to other buildings. Looking at the eligible buildings, some of the buildings, again, are easier to do those improvements and get into the low risk category. We can get those online sooner. It's important to note that the work really does have to be done on a per building basis because these systems, the air handling systems in the building work as a system. It wouldn't work to try to get a few classrooms online in each one because it's a systematic problem. We have to deliver them building by building. And working with the public schools, we came up with, we grouped them into 3 groups for planning, for construction and planning purposes. Which leads us to the conclusion, this is important for everyone to know, that students may not be returning to their original school this year. I mean, that's blatantly obvious for the Brown, but for the other schools, it also holds true. The building that a student left last year may not necessarily be the one that they re-enter as we go into the hybrid in-person plan. So our first group of schools, the ones that already had sort of the lowest risk score and have systems that are easily adaptable, are the Argenziano, the Capuano, and the West. We have been doing the next round of detailed design on those, and we obtained a waiver from the state for us to not follow the traditional bidding process. We actually brought contractors in on this. We reached out to 8 contractors. We had 4 that actually partnered up with us, walked the buildings. This was a very collaborative process whereby the contractors were looking at what it is we were proposing. They came back with feedback and questions. We disseminated all of those answers to all of them so that the prospective contractors all had an equal footing upon which to develop their bids and really put the detail on what it is that can be put into these buildings. We have just finished that process. The last details of that are being handled tonight. We hope to have final quotes on these some point tomorrow, which means that on Monday, we will have the solidified plan for these 3 schools and we'll be able to make that public for these schools. The plan for these schools are a range of interventions, both improvements to the centralized system, increasing the percentage of outside airflow, increasing the resolution on the filters, putting in inline UV disinfection, putting inline humidification, which also reduces transmission, but also a number of in-room interventions. This is not relying solely on the centralized system. We will be putting in-room humidifiers, in-room HEPA filters, and the HEPA filters that we're specifying out are essentially, hospital grade HEPA filters. These aren't the ones that you go down to Home Depot and buy. This is very important for long-term operations maintenance and also for very high levels of protection in these areas. You can move to the group 2 on the next slide. As soon as we finish those group 1 schools, which is Monday, and we'll be able to publish that on Monday, we're turning we've already started work on this, but we'll really focus on getting the group 2 school plans together. The schools can you go back for a second? Yeah, so the ones in group 2 are East Somerville and the mods. And we're planning on going through all that detail next week with the target of releasing the plan for those schools the following week. Moving on to group 3. And again, these are a mixture of centralized system upgrades and in-room upgrades. The group 3 schools, because of the types of systems that are in these ones, these are slightly older schools compared to the other ones in group 1 and 2. These are a little bit more difficult to implement. Also, part of it is the size that the Kennedy School is rather large, 2 wings. The Winter Hill School was built in odd period in terms of construction. We're really wrestling with the detailed plans for this. We're moving as quickly as possible, but again, being very thorough. They have the potential to get down to the low risk, and we're developing those plans and hope to have them closer to the end of the month. Move to the next slide. It is worth mentioning that the new high school already achieved our lowest risk, that the new systems that are in that new high school were already handling air to our threshold. So as soon as construction on that new high school is complete and we're able to turn it over, we're already achieving what it is we need to achieve for that building. Just sort of a overview of the timeline. Again, we started this with June, defining the scope and hiring the consultant, site visits, and identifying the risk. Many of you may have heard some of these things at the previous town hall. And since that time, we've done that preliminary design work, schedule and cost estimates, the procurement strategy, all of that is being solidified. It's essentially done for the group 1 schools. We're finishing that for the 2 and 3, and then immediately undertaking these improvements in the schools, and we can start our phased opening in December. So then this is sort of the timetable for the buildings. The group 1, we essentially have our work plan ready to go and are looking to sign up the contractor for that next week. Working with the Somerville Public Schools, we are able to house most of the highest needs in those buildings with the phases 2A and 2B and 3A, essentially special ed, high needs ELL, and pre-K and K in those buildings. The Somerville High School coming online in December and January it has identified a priority for Next Wave Full Circle and CTE seniors. Moving on to the group 2, the mods in the East. The detailed plans for those buildings are still being ironed out, as I said, but we're targeting, January timeframe to be able to turn those over. January, no later than February, and that would allow phase 3B, grades 1 and 2, and some grades 3 through 12. Again, the buildings that were less certain on the timetable are the Healy, the Kennedy, and the Winter Hill. That timetable is looking to be more like March into April. We'll be defining that more over the next couple of weeks, which will allow for phase 4. Given that we still have uncertainty in when we can deliver some of these buildings, we are still working with Somerville Public Schools on how to best use those buildings. At this point, no option is necessarily on or off the table. Looking at some of the comments and a lot of questions are being asked about how the new high school will be used. I don't think we have come to a full conclusion on that. There are some logistics around what that would be best suited for. It is a massive space, and thought has to be given on how to use it. But in terms of how grades 3 through 12 will occupy this suite of buildings and when, those are details that we're still working through as we determine when these buildings can come online.
Yeah, and Rich, I just want to, just if we can go back to that slide for a moment. I just want to reassure parents that over the next several weeks, as we get the more detailed information on the timelines of the mods in East Somerville itself being a very large building. And then relatively speaking, the order of Healy, Kennedy, and Winter Hill, we'll then be able to make some more definitive decisions about how to get back some of our youngest students, going in order from first grade, second grade, up through the 8th grade. So we have not made those decisions yet because we want to have all the information to make them, but they are certainly on the table fundamentally. As Rich said, there's nothing off the table at this point. I think we just want to have a complete picture, as we have tried to do along the way, to make the best decisions to place programs. In the case of the phase 2A and 2B and 3A, they required often different facility setup as well. So for instance, they may require more bathroom usage, more nursing. It depends on the program, and even transportation. Part of the challenge with transportation that is part of the plan of where programming is going is that we have a reduced capacity for transportation due to the 6-foot social distance. So it's very complex in figuring out where and how to best use the buildings as they come online. But these are things that over the next several weeks, working in collaboration with Rich and his shop, we hope to have more definitive answers and to be able to further work down the chart. We're also working very closely with our teachers union on this. We're in active negotiations, and we're also having a lot of meaningful conversations about student programming. So, we hope to have even more to share, particularly at our next town hall, which will be in early November.
No, before I transition fully to the superintendent, thanks, Rich. I do want to remind us all that, again, that our return to any form of in-person education is dependent on aligning both these internal, external factors that we mentioned, and getting the ventilation piece into place is the biggest hurdle on the internal side. So I do want to thank Rich and his team for their work, usually a process that takes several months. As those work plans, it's been asked in the chat, I'll answer it now, become complete and they're finalized, we will disseminate them to the public. But again, I want to thank his team for how the work to create low transmission risk and learning environments for our students and our staff. So we'll be continue to be looking at the bigger picture, and I want folks to understand that. I do want to hand this back over to the superintendent to talk about our phased hybrid in-person learning and how that begins.
Great, and I will go through these somewhat quickly because we do want to have a little bit of time for questions. Some of this is review, so this is laid out in the original reopening document, and as such, it was specifically around bringing grade pairs together as they come back. Obviously, in phase 2A, B, and 3A, we're looking for our special ed high needs, all grades, our ELL levels 1 and 2, which would be K to 8. And then at the high school, bringing back the high school L's levels 1 and 2, pre-K and K, and then also Full Circle Next Wave, which we see as a high need therapeutic special education program, would be one of the first back into the high school, as well as the CT seniors, given that they really need some hands-on in the shops, and the shops are set up beautifully and well spaced. So these are kind of following down as we had intended. We also want to look at a way to be able to use some of the common spaces in the buildings, Genziano, West Neighborhood, and Capuano, and be able to use some of the space that would be larger space in the buildings to potentially bring in sort of learning centers, some of our resource room students for special education, as well as students who may be homeless or have house insecurity, as well as those that may be DCF involved and need just an extra layer of support where the remote model is not working as well as we want it to. So we're really trying to put all space on the table once we get that space back in a way to accommodate as many students as we can. So again, this is some repeat information, so I'll just go through it quickly, but this is just in general the number of classrooms and students and staff that would be associated with each of those phases. For families, we will be doing personal phone calls. So if you are in phase 2A and 2B, high needs special education or English language learners, we will be doing phone calls through special education department, through our English language learner department, and through our SFLC to you to talk through the option of returning in person, to be able to answer any questions. We understand it's a complex decision and there may be some questions that need to be answered. So that will be happening. And then for 3A with our little guys, pre-K and K, similarly, the week after next, you'll be getting those personal phone calls as well. You know, again, just a compliment, but in the hybrid full remote, we made a commitment and we will see that commitment through that. We recognize it is parent choice, and some parents have indicated that they would like their student to stay remote, but they want their student to stay with SPS teachers. And so we will be over the next week, both in the survey data we'll be collecting through personal phone calls with students and staff data that we will be sending out through survey, doing our best to figure out what portion of the students will be returning and what portion of the teachers will need to teach remote, and then being able to put something in place to make that match happen. So it'll be a very intense next 2 weeks as we get a lot of that work done, but we will stay in our commitment to make sure that those parents and families that want their student to continue in the full remote with our teachers are able to do so. There is always the option for the LMS, that is the learning management system. But again, that is a very separate system. And if that is something parents are interested in, they can contact Assistant Superintendent Chad Mazza. Here, just really, it's just explaining again that the hybrid full remote is much like what's being experienced right now, which is each day the student has interactions with their teachers. It ranges anywhere from, you know, an hour and a half for our younger students to up to 4 hours of synchronous live learning and teaching where it's adult led. And then there's a few hours of asynchronous, which are all based to the standards and all developed by the teachers, but those are considered more independent types of activities. That is a very similar model. So were you to want your student to continue to use the current model, that is what we are committing to make happen. And just as a reminder, when we're talking about the hybrid in person that we're coming back into with our high needs special ed, our English language learners 1 to 2, and our pre-K to K, what we're talking about is a Monday, Tuesday cohort, a Thursday, Friday cohort, and then a Wednesday where everyone is remote doing some synchronous instruction and some asynchronous instruction. And so that really is, if you're a student and you're in cohort A, then on Wednesdays, you're doing that synchronous, asynchronous, and then on Thursday, Friday, you're doing that same situation. So we will be sending more information out to parents on the hybrid, and that'll be part of the conversations that, as we call and have that conversation to help you make a decision, what's the best fit for you and your family. We're happy to provide whatever information you need. And then just finally, you know, I think as Rich indicated, we don't have all of our building assets, so we have to use what we have. And so right now, knowing that we have Argenziano and Capuano and West Somerville, we have to fit the programs to the building assets that we have and do it in a way that brings our priority populations back. So for this year, we will be housing at the Argenziano our English language learners levels 1 and 2, our special education programming, and we will be in touch with the parents and the staff of those particular programs. And then our pre-K and kindergarten, there will be some classes at the Argenziano. If you attended, for instance, kindergarten, you know, at say the Kennedy, then you may likely be going to the Argenziano for this year only to continue your kindergarten experience. At Capuano, that will continue to have predominantly what it has now, which is ECIP, special education programming, and pre-K and kindergarten, with the exception of the Healy pre-K and kindergarten will be served at the Capuano. We tried to place these programs not only by program need in the building, but also by geographic location, and to kind of create a concentration of staff from particular buildings so that there's familiarity and they can work in collaboration. And then at West Somerville, there will be special education programming coming over from the Winter Hill and the Kennedy, and there will be pre-K and kindergarten. So you will be getting a phone call from our staff over the course of the next 2 weeks to both answer questions and to specifically let you know about that assignment and to talk through with you and your family what's the best decision for you. And then we will have a further update in November as we see, what portion of our students are going to remain remote. That may open up some opportunities in those buildings for additional students to return.
Thanks, Superintendent. Just for folks tuning in, for other updates and information, we'll be having another town hall in mid-November and update where we've come from this point to that, and hopefully getting closer to some openings. The Resistat town halls will be coming up. We ask you to consider signing up for city alerts, and also there is a Board of Health meeting that I believe was posted just before this one on Monday at 6 p.m. We'll be considering any orders affiliated with the school reopening plan as we have outlined. So we are getting to the point of questions. We are going to go to 8 p.m. Obviously, we have a lot of questions. We're not going to stop at 7:30. We want to try to answer as many questions, and we'll do our best to get through as many as possible. If we don't get to your questions, please know that our school communication staff will gather the unanswered questions and use them as a guide for future emails or web information, and we'll review them and in the aggregate also address them. And if your question is specific to your child, as always, you should contact the principal. If any other questions, reach out to any one of us in our departments. You'll find our emails on the city's website and school website as well. Before we take questions, I'll say your questions you can ask on the Q&A function. I see many of you have done that. We got some through YouTube live chat function. We have some that were previously submitted. Before I take questions, I do want to recognize, I apologize to my colleagues for not doing this sooner. The chairperson, because they've all done a terrific job in supporting, giving their input on how we move forward, relaying your concerns and questions to the team. The chairperson of the Somerville School Committee, Ms. Carrie Norman, the school committee person from Ward 2, Ms. Ilana Krepshin, the school committee woman from Ward 3, Dr. Sarah Phillips, the school committee person from Ward 4, the vice chairperson, Mr. Andre Green, the school committee woman from Ward 5, Ms. Laura Patone, and the school committee woman from Ward 6, Ms. Eleanor Barish, and I also want to recognize City Council at Large, Kristen Strezzo. There are other councils. We have other meetings to attend to tonight. They may have tuned in, and if they join us, I will recognize them. Again, if you have your questions on the Q&A function or on live YouTube live chat function, I will do my best. If a question's already been asked and answered, I'm going to move on to the next one. I'm going to do my best to recognize as many questions as possible, and individuals who haven't had a chance to answer a question. So these are questions that came from the English Learner Parent Advisory Council. So I thought we should ask these first and not go in order. The first question, why are English learners at levels 1 and 2 prioritized for in-person learning? Madam Superintendent?
It's a great question. So I'm going to actually ask Director Davila to answer that, who is in charge of our English language learner programs.
And a member of the LPAC. So
And a member of the LPAC.
Yes, the LPAC is a wonderful group of parents of multilingual learners in the district. So it is a fabulous question, and anybody who has ever practiced or learned another language knows that the best way to do it is in interaction with others. And even though many of our language learners have done really well in the remote setting, we know that tackling the English language and all the content areas really will be better done when we are in person in school.
Thanks. Another question from the Advisory Council. How will transportation work if students have to go to other buildings? Will there be buses Or will there be an option for parents to safely drop off and pick up their children?
So I can answer this. So both Director Trevisoni and Director Davila have been working hard on this. The answer is yes. If students are in those programs, we will be contacting them as we do our outreach over this next week around the transportation pieces. Typically, transportation used to work such that we had buses coming from kind of opposite ends of the city. Now, since all of the L programs will be happening at Argenziano, there will be various pickups, but all drop off will be at Argenziano. We will likely need to do 2 runs. So we may need to do a slight stagger of the time for our L students, but we will be able to do those runs having talked with the bus company. I know Director Trevisoni is also having her staff reach out individually. Special education transportation is a little bit more complex in that there are pickups on the end of street as well as door to door. But that is also going to be in the phone calls that happen this next week. Parents will be invited to kind of share what they need, and then we will do our best to get that for them through the transportation company. And yes, there will be an opportunity for parents to safely drop students. We will not be inviting parents into the schools as we normally do, because we do need to control not having more adults in the buildings, given the safety and the health of COVID. So, but we will be arranging drop off and then different entrances for students to go in as a further way to be able to split the traffic of the students. All of this will be communicated through either the L department, special education department, or your building principal. So you'll have all this information well in advance of returning in December.
Another operational question around the schools from the advisory council. How will recess and lunch work? Will students receive food in the classes, or could they bring their own lunch?
Mm-hmm. So again, the answer is that yes, they will. We are going to bring the lunches and the breakfasts in a grab and go format to the classrooms. We will then, where possible, let students eat outside if it's nice weather to get them out. Same with recess. We will also use hallways, and we may use classrooms as different places that students can spread out in order to eat. We will always be maintaining the 6 foot or more distance during that time. In terms of bringing food, the answer is yes. That said, we always have to be concerned about food allergies. So Lauren Mancini and Doug Kress will work closely on this to give guidance to parents about what is acceptable to bring and not bring for food from home.
Mayor, you're on mute.
I'm sorry, folks. I'm going to do this over again. I should know this by now. I haven't done about 1,000 Zoom meetings as much. So what will schools do if, for example, there is one case reported? Will they stop everything again? And again, Doug, I think it's a good opportunity to explain the advantage we have now with a surveillance testing piece as part of our internal factors that help guide us to strategically contain any outbreak or understand how the pandemic is moving in our schools.
Thank you, Mayor. So if a positive case does appear, I think this is, again, one of those reasons why we are really lucky to do the screening testing that we have available to us, because we're able to catch it early. What we'll do, as I said earlier, will be referred over to the contact tracing team. Part of that is to really identify who may have been within that 6 foot barrier, or that's within 6 foot of the individual for more than 15 minutes over a 24-hour period. Those individuals then would obviously be quarantined, and we will follow up with them and as they are close contacts through our contact tracing team itself. So I think the question is, does that mean the entire class will be quarantined? No, that's not necessarily the case. It will depend upon how close they are to one another. If they are within 6 feet of one another for more than 15 minutes, again, that is cumulative. Is it possible? I think that may be possible depending upon the classroom setting as well. But again, we have to reinforce the ideas of the other situations we're talking about. And that includes making sure everybody's wearing their mask that's covering their nose and their mouth, and also ensuring that there's the 6 foot distance between everybody.
Thanks. Before I take the next question, I do want to recognize, I apologize to her. Not only did I forget to recognize her, I forgot to recognize her as the vice chair, Dr. Emily Ackman from Ward 1. Sorry, Andre, no offense, but she is the vice chair and you are not, my friend. I have some questions coming in on the chat function and Q&A, and I'm going to go to them. And thank you in advance for anybody who's offered a question or comment. We'll do our best to get to all of them. I think my Italian is close enough to the Spanish to understand. Las actividades after school se están cancelado con llueve. I think saying the recreation programs after school are being canceled when it rains, are being shut down. Is that correct? We have a response to that?
I can take
Thank
that.
you, Carmen. Carmen asked that question. Thank you, Carmen.
Sure. So we only cancel in the event that it's really bad inclement weather. We will, as Superintendent Skipper mentioned, continue to run the programs through December. We know that it's a great outlet for kids and parents. And though we may have to take some of the tents down because once we start getting snow, they're not going to hold up. As long as it's safe and as long as kids can gather, we'll continue to run both the rec and the community schools programs.
That's a good segue from one of our other constituents. Julie Engel asked, what will be the plan for Somerville Rec and Community Schools program once the weather turns? Will they keep running outside and suggest kids wear warmer clothes or stay inside? But we're considering more tents or just stopping off it altogether. I think, Jeff, you just answered that. So Julie also, thank you for that question as well. I'm going to go to the chat, to YouTube live chat, because that's where a lot of our translation is happening. So from Diana Posada, she asked if high schoolers won't be able to receive classes in person as K-8 students might. Is there a way that high school remote learning schedule can be revised? Is this a possibility? No. I'm sorry, that's it. Is this a possibility? Thank you, Diana, for that question.
Yes, thank you for the question. It's a great one. So I'm going to answer a little bit of it, and then I'm going to ask Principal Agambina to talk about the schedule piece. So in terms of the high school and the usage of the high school, I think what we're trying to wait to see is what will happen with the other building assets, how quickly they can come online, so we can look at the other grades of students, particularly those who would struggle or struggle more doing the remote. So certainly up through 8th grade. So once we get that information over the next couple of weeks, we will reassess and then be able to look at what portion of the high school we might be able to use to be able to service students other than high school students. Principal Agambina, I don't know if you want to chime in on that.
Yeah, I mean, we've spent a lot of time on our scheduling and cohorting students and making small class sizes, so we would have flexibility in both the hybrid, full remote, and full in person. So the plan at this time isn't to change the schedule, but we are keeping an eye on everything. And as circumstances change, and if we are able to go through the phases, we will keep an eye on the schedule. But we did design the schedule to be flexible enough to meet all of the phases.
Right, and I would just add to that you know, one of the things about Somerville High School that is a very beautiful thing is it is a large comprehensive high school. So the fact that students have access to both, you know, top-notch CTE programs at the same time that they have access to advanced classes, it makes the schedule itself very complex. You add to that at the high school level with students, you have a much larger volume, 1,300 students. So how we did the schedule of breaking students down into smaller classrooms of 20 was to really kind of look to the future and say, how do we make this the safest possible? So I'm sure, knowing the high school team, that they will do some due diligence with this and we'll look at it from all sides. I would also suggest that if it's an individual student issue, to just see the guidance counselor.
Thank you. Another question is translated in the chat function is this: if my son goes to kindergarten at East Somerville, according to this, I understand he will be sent to Argenziano?
Yes, so that for this year, yes, that we would, Again, for kindergarten, yes. I think what we're waiting to see is how quickly the East Somerville building can come online. That will help make a determinant whether we can keep more classes and more students who are at East Somerville, or if we have to shift them to someplace else. But right now, the kindergarten would be scheduled to go over to the Argenziano.
Another question from Clara asks, what are the plans for hybrid/full remote for freshmen?
So it is the same answer, which is that we really need to see over the next few weeks what is going to entail with the timeline for the rest of the buildings. Once we have that, then we'll know how best to use the high school real estate. We do know that, freshmen, it is important for freshmen to have a solid freshman year. And so we may also want to look deeply at what freshmen might be struggling with the remote learning. And this may be something that we look at the high school population in general to see, as opposed to bringing everyone back, if we need to use the high school real estate in a different way.
So go ahead, I'm sorry, was somebody else going to add to that? If not, a couple of questions around metrics, and I'm going to combine a couple of these because they're late. Second, folks, I'm sorry. The first has to do with our approach to a certain economic sectors and also comparing that to schools. If schools aren't open, why is Legoland open and schools not? And there was another question, and that was from Rebecca and Zana, I believe. I'm sorry, I'm just, the messages are flying in the Q&A section. And the other one regarding, will we be rolling, that was from Rebecca and Zana. And the other one from Gabrielle Jaquette related to this, prioritizing school reopening. Knowing as we do that school COVID rates are linked to community rates, why are we keeping bars and restaurants open? Known drivers of transmission when we are in the red while schools are closed. These are valid questions. Let us explain, and I'll ask Omar Bukili and Doug Kress to chime in. First of all, we have been analyzing all the data. As our data has increased or stayed stable, we'll try to understand, are there any sources of increased cases? If there are, if we determine any activity in our community or any economic sector that we've expanded is the cause or the source of those increasing transmission rates, we will curtail those back. There is no evidence directly of that. Really broadly, it's around familial and communal settings. I want to remind everyone that we did not move to phase 3.2. Because it flew in the face of advice from experts, and the governor increased certain gathering sizes and other activities that pose a high risk of transmission. We did not do that. And establishments, whether they're fitness centers or restaurants or like Legoland, they all have a site safety plan that we review to talk about all the steps they must take to mitigate any interrupted transmission from person to person. And that operation, particular operation, Legoland, is not in full operation. So not all their operation has been allowed to expand. Omar and Doug, did you want to add to that? Did I miss anything? But thank you for those questions, Rebecca and Gabrielle.
I think you did a great job with answering those questions, Mayor. And I think the other thing to keep in mind is that, those are really confined short-term gatherings. But again, I think that one of the concerns that we are seeing is the familial type of gatherings where people are at, where we are seeing some of the spread of virus. So we need to make sure that we continue to follow those public health practices. I also remind us that bars are not allowed to be open right now. Those are actually not until phase 4, according to the state guidance as well.
If I could add to that, Mayor, and just wanted to clarify one fact in there. There are no bars specifically who are open in the city of Somerville. The only activity that's open that's remotely close to that are dining establishments. And every activity that we've made recommendations to ease the restrictions on is under a very strict capacity load cap. We've reviewed their safety plans, and we've made sure that any type of environment or entity or space that is conducive to gathering, lack of social distancing, any type of activity that would involve inebriation, screaming, singing, all those things have been flagged, and we made sure that none of the stuff that we have open right now is part of those risky activities. So it's a delicate balancing act, but as Doug and the mayor just mentioned, we keep really a close eye on the data, as patchy as it may be. At the first sign of either clustering or seeding of clusters coming out of those activities, we will take the appropriate measures very swiftly.
So Elizabeth Caffrey asked, and thank you for the question, what are the levers and metrics to reopen and when to close down again? Every community has a plan that is clear and transparent, whereas Somerville's plan, what you have shared, is not a plan. Well, let me try to clarify, as we touched upon in this presentation, and again, I'll ask Omar and Doug to chime in. We look at a collective and a set of data in terms of what's happening in our community, what is happening with availability and turnaround testing, and, you know, the transmission rates in our city, the incident rates, the positivity rate, a whole host of data that we're looking at holistically. But I want to stress that the surveillance testing plan that we're putting in place allows us and gives us the ability to understand of what is occurring in our school buildings as it relates to our community, taken in that context. So, for example, going back to the color-coded map that the Commonwealth had been using widely until this week, it gives us, even though we could be high risk or moderate risk, assuming we're high risk, if our surveillance testing isn't showing any spread or activity at that level in our schools, it allows us the ability to continue to remain open. Otherwise, it's a guess. And if we have, otherwise we have the situation, we might have a case appear in this school or that school, and it goes back to the whack-a-mole approach that we've had to implement at the beginning of this crisis, and schools have had to react to now. Omar and Doug, did you want to add to that? And thank you for that question.
Mayor, I think the only thing I want to add to that is going beyond a little bit more of what you're saying, where our goal is really not just to bring our students back short term, but how are we making this plan that's sustainable so that we can keep our students into the classroom. And that's why the protocols we put in place are really important, that we follow all of those protocols so that we can have that sustainable keeping our students in school and build on that as we move forward and as the space becomes available.
Thanks, Doug. This question from Tim Sackton, it's just a continuation of this line of question and answers. Thanks, Tim, for this question. That's two parts, so bear with me, folks. Cases and positivity rates have been increasing in Massachusetts, and community spread is a critical factor in safe reopening. My question is two parts. First, what actions, if any, is Somerville taking or considering to reduce community spread and prioritize keeping our schools open once they do open? In France and Germany recently, pretty substantial shutdowns. Example given, bars, restaurants, theaters, gyms have recently been implemented to reduce community spread in order to keep schools open. Second, when we go on that part first, and I'll ask the second part about HVAC, I do want to say that these are good points, Tim, and I'll allow Doug and Omar to chime in. But this also speaks to here in the metro region, which is so densely populated, the lack of a regional approach to taking on spread and containment is hampering our ability. Again, Malden was rolled back in their phases, yet Everett and Somerville and Melrose were not, even though we're direct abutters. So I would make that point, but also Doug and Omar, did you want to add to that first part of the question?
The only thing that I would add to that, Mayor, is really looking at this, and this is an additional argument of why we want to make sure that screening and contact tracing is a robust part of our protocols to move us forward, so that we can slow that spread of the virus. And also understanding we have to think of multiple metrics when we're looking at those. School transmission is one of those, but there is community transmission. But we also know that our school district and our students in our schools are a little bit different than the entire population of the city of Somerville. So we want to make sure that we're looking at these things, these items and these matrices specifically and independently, so that we can see how they will cross over and make the right decisions in order for us to move forward.
If I could add, Mr. Mayor, we've really tried very hard to expand every human and financial resources to communicate with folks in the community and try to make them understand that there are certain activities in their, especially in their familiar settings, that can be risky and cause that type of community spread. The other component of it was the emphasis that we had on community testing, which is why we've had community testing operation in collaboration with CHA since the end of April. It's extremely important for folks to get tested so we can get a read of their status at that time. The third piece I wanted to add is that those metrics that either are published in the Department of Public Health or that you see in our dashboards are supposed to be taken on aggregate. Not one indicator is going to give you a good read of the context. It's trying to figure out how to come up with a composite picture to be able to inform the decision makers on the city side and on the school side from a management standpoint. Otherwise, we would be in a situation where we'd open, close, because we have no idea what is actually going on the ground.
Thanks, Omar and Doug. And the second part, I'll answer. And again, Tim, thank you for the thoroughness in the question. Does the city believe that the extensive extra mitigation measures, HVAC, adjustments, testing, being implemented in our schools and not elsewhere mean that we will be able to keep our schools open even when community transmission rates are substantially higher than they are now? They definitely give us the ability to do that if it's shown that transmission is not occurring in our schools, because we'll know that real time. The HVAC systems are one of the ways we mitigate risk of transmission from person to person. The testing gives us information real time along with contact tracing to understand how the pandemic is moving real time in our schools and to contain if necessary. So thank you, Tim, for that question. So back to the YouTube chat, Kelly Duda asks, with hybrid full remote and also the option to go in person, will children be changing teachers?
So this is an excellent question. In some cases, yes. We have to see, we will have some staff who will need to remain remote because of medical accommodations. So there will be some change necessitated there. Additionally, there may be situations where there are more students that want to remain remote than to come in person. So we will have to rebalance some staff. We will always try not to have that happen, but there realistically will be some changes. We will do everything we can to help students acclimate to their new teacher. And the great news is that we have all of our teachers are fantastic in SPS. So you will get a great teacher one way or the other.
Another question from the YouTube live chat. When is the expectation, when is it estimated the return time for high school students who are not CTE senior/ELL?
So again, it's a great question. Over the next couple of weeks, as we get more information back about the other buildings, we will be able to better determine the high school students themselves, what schedule they can come back on, and what parts of the building we may need for other purposes.
Thanks. Heather Stockwell, thank you, Heather, and also all those who asked questions so far, asks, what SPED students are considered high needs?
This is a terrific question. And I think I wanted to just make sure that I emphasize that those students that are in 2A and B, which are our high needs L students, which would be levels 1 and 2, and our high needs special ed students, those students are 4 days a week. Starting with phase 3A, which is our pre-K and K, we go into the hybrid, and those are 2 days a week. Director Trevisoni, do you want to address which programs would be considered high needs under special education?
Sure, thank you, thank you. The high needs students under special education are the students who are currently placed in specific programs across the city. There'll be students in the autism program or ECIP. Those are students that teams have determined require that level of support.
So Director Trevisoni, could you just list some of those programs? Parents may know more by the program as opposed to.
Okay, so AIM is the autism program, and there are some classrooms currently at the Capuano, preschool through kindergarten. Those would stay at the Capuano. And then first grade through 8th grade at Winter Hill would be coming back full time, 4 days a week. SKIP and SHIP, who are high needs intensive programs, both at the Kennedy and at the high school, will be coming back in the high needs. Multi-graded classrooms that are currently at the East and the Healy will be coming back, and life skills classrooms that are at the Kennedy and at Somerville High will also be coming back, including the transition program. And then we have our program for Down syndrome students at the West, and we will be bringing those students back because they will benefit and require this level of support.
Great.
May I also
Amy?
get clarification on the EL 2B as well?
Certainly.
Because there has been a little bit of confusion, I think. So when we're talking about WIDA, that's a EL level 1 and 2, we're talking about the specific program, SEI 1 program, levels 1 and 2. So like special ed, it's programmatic. And when we're talking about the UNIDOS program, right now, we're looking at the whole UNIDOS program for kindergarten and grade 1 in phase 2B.
Correct. And I would also say full circle next wave, which although is middle and high school, we see the students that are in full circle next wave as being therapeutic. And so therefore they would qualify for high needs.
Amy Marinville asks, will high needs special ed be 4 days in person or 2?
It will be 4 days. And I didn't want to forget SEEK. SEEK is considered a program as well. They will be 4 days.
Okay, thank you. A follow-up, I do want to ask this follow-up question to a previous answer. Thank you for that answer. We're changing teachers. Will children have teachers from their schools? I think we answered that. Or could there be assignments with teachers from other schools, specifically kindergarten and second grade? I think we
I'm
answered
sorry,
that
I
one.
didn't get the end of that question.
Or could there be assignments with teachers from other schools, specifically kindergarten and second grade?
Yes, that is that is certainly possible. These are all SPS teachers. And there may be some additional teachers that we will be hiring in to accommodate, but they will all be SPS teachers.
Okay. I hope I got the name right, from Lilo. The chart didn't list where and when Brown students will return. Will it be the trailers in front of the school in early January?
So again, we want to be able to see the rest of the building assets, including the mods, including East, and including the Healy and the Kennedy and Winter Hill. And over those couple of weeks, we will then be able to better situate how programming will be done. And so we will have more information for Brown families at that point.
This question from Warren, for those of us who don't answer phones much, will we be contacted by email as well?
Yes, we will use every possible means to contact you. Typically we will look in Aspen, and often there's a preference for contact, but we will also be communicating with schools as well. They'll often have other information that we can use.
From Donna Clark, children who are on IEPs but not in substantially separate classrooms are left behind in this plan. What will you do to compensate for this?
So I really appreciate this question. This is one that we're talking actively about. Director Trevisoni?
Yes, so we're actively talking about creating learning centers in the buildings as they open so that we can continue to support and service students. And that's something as a special education department with all of the special educators and service providers that we've begun to work on, as well as I know that ELL is working on the same thing, learning centers for students.
Correct. There are L levels, and Director Davila, do you want to just in terms of?
Yeah, no, this is something that we're really looking at. And if I can expand beyond L's, that might be at level 1 and 2 in other integrated programs. We're also looking at other categories of students that might need this support, if I can mention homeless students, and maybe students who are DCF involved, or students who are just that we've identified and the principals have identified as just not doing well in the remote learning setting.
Correct. We have over 100 students who are categorized as homeless in SPS at any given time, sometimes more than that. And so you can imagine being home insecure and not having a place to really work from because you're based in a shelter. That is an incredible disadvantage in remote learning. Similarly, students or families that may be DYS involved generally are requiring a higher level of support. And so those two would be students that we would want to be able to help out.
From G. Daly, are you planning for any chance of 4 to 5 days of in-person school for kindergarten/young children? Seems like this is only going to get to a hybrid in-person. Did I state that clearly? Let me state that again. Are you planning is there any chance that you're planning for 4 to 5 days of in-person school for kindergarten young children? Seems like this only gets to a hybrid in-person.
So right now, yes, we are planning for pre-K and K to come back in a hybrid, which would be the 2 days a week. I think much of what we need to look at is how many students are planning to return. Once we have some of that information over the next week to 2 weeks, we will better know what we have for actual assets. Same for how quickly the other buildings can come on. We, more than anyone, want to have our students back, and we want to have as many of them back as possible. So the combination of families that have made a decision they're going to stay remote regardless, combined with the assets that come online, will help us to be able to determine what additional populations we can serve and how much more time they can spend in school.
From Katie McGee, would students ever be able to switch cohorts?
So I think in general, we cohorted the students with a plan in mind for the number of students that we would have in classes. There will likely be some rebalancing just because there will be likely some more students in one cohort than in the other who choose to stay remote. So I think once we have those numbers down, we can talk with the principals about the best way to proceed in terms of if we do need to rebalance a cohort and a parent has an ask, we may be able to accommodate that.
I'm going to pivot to a question for Rich Raish. I'm sorry, does someone want to add to that? Did I interrupt? The question for Rich Raish from Beatrice Gomez. Thank you, Beatrice. Please confirm Commissioner Agent is part of this process. HEPA filter increased pressure drops in systems. How are we ensuring systems are balanced and performing as intended to meet the ratings established by the city? Just want to confirm a wise investment and process as per ASHRAE recommendations. It would be great to have MEP engineers explaining or have a memo distributed of the recommended improvements to schools and how this will improve building safety. Also, how will city avoid a false sense of security and make sure all safety PPE measures are followed in schools? Will city provide support for teachers for monitoring mask wearing, social distancing, hand washing? So we have one for Rich and one on the operational side, it appears.
So recommissioning and balancing are in scope for our contractors. So we're essentially going to verify that the systems are going to work the way that they're designed when we're done. Just a point of clarification for anybody else who's an MEP, the HIPAA filters will be in-room units and the centralized systems will have MERV 13 to avoid some of those pressure drops that you mentioned.
Okay.
And I would just say in terms of monitoring for mask compliance and so forth, that will be something that will be an important piece in each building and part of what we will work on with the leadership teams. We also have our central staff, which will be out in the schools as it always is every day. And so we'll be able to use them in various ways as well to ensure that protocols are being followed.
Thanks, Mary. I should have also mentioned that for the air handling, we're also installing CO2, carbon dioxide monitors in each one of the rooms so that we can verify on an ongoing basis as they're occupied that we are indeed getting the air exchange rates on an ongoing basis.
Folks, we're going to go to 8:15 because we have so many questions. So those who tuned in today, I'm going to take we get about 16 more minutes here, and we're going to take as many questions again, try to get to as many as we can. From Daniel Fireside, when we go hybrid, are you still planning on having kids attend school on different days than when they are going? And when are they going to after school?
So I'm going to actually, Assistant Superintendent Maza, I will tag you in. So the question about the hybrid and the structure of the hybrid, and then Dr. Curley, if you can answer the question about the after school.
Mary, can you just read the beginning of that question again so I get it straight?
Yep, 1 second. And it's from Daniel Fireside. When we go hybrid, are you still planning on having kids attend school on different days than when they're going to after school?
So I think that could possibly be a combination of both. I know, we'll have kids attending Monday, Tuesday, and then be asynchronous Wednesday, Thursday, Friday. and then have kids being asynchronous Monday, Tuesday, Wednesday, and attending on Thursday, Friday. Dr. Curley, as far as after school?
Yeah, I think the feedback we've heard pretty overwhelmingly from parents is that it would be helpful to have after school align with the days that the students are in person. And so we'll make that adjustment. So if your child was eligible or is eligible to come in Monday, Tuesday, we will arrange after school on those Monday, Tuesday days. We understand it'd be a hardship for parents to come in on days that their students aren't in the afternoon. So we will make that adjustment and communicate that out. There was a question about the rain and the weather coming up. I just want to reiterate, as we have buildings coming online, we will be expanding after school access as we normally would. So we will make do, obviously, with the buildings we have into this December shoulder, but as soon as we have more buildings online, after school will continue in those buildings.
Mr. Mayor, if I could just add one more thing, and I think the important piece of aligning the after school with the days that the students are in person, it just gives an extended day, 2 full days of learning and then after school activities, which we know is important. We've heard that feedback from families.
While it may be possible to be able to do some adjustments relative to the cohort, once that is solidified and we have the students matched in the cohorts with the after school, it's not really possible to move them, because really then it becomes ensuring that the students are together as a group, and that they're doing their activities as a group, and that's just a health and safety, given that we're in the pandemic.
This is from Martin. How many isolation rooms will the schools have? More than one?
I can take that one. With the school nurses, we are identifying a room within each of the schools to act as a wellness room. We don't like to really call them isolation rooms, they're more of a well room. So we can put put our students in there who are exhibiting some of the symptoms for COVID-19. And that will be the place where we will have them wait until the parents can come and pick them up.
Right. I can't recall if I answered this, but no harm in trying to answer from Kretcher Roldan. Kretcher, I apologize if I mispronounced that. Would early childhood centers have access to COVID testing for staff and children? I guess that's for Doug or Omar or both.
Sure. Omar, do you want to start?
Sure. So as of now, the plan that we've been able to formulate with the team does not include those learning and care centers. The intricacies and the logistics of it are really daunting. Our focus was specifically on the public school district as a system. I think would be Doug and I and the team are happy to meet with folks who operate those centers and share what we've learned, best practices, and help them advocate. I can't, at this point, I can't see a situation where we can say, yes, we can extend it because of the novelty of it, the time and efforts it would take us to roll it out in the public school district, including all those entities, the way they're spread out in the city would be really challenging right now.
Rich, I believe this is regarding the progress of the actual new high school construction from Manoj Acharya. Again, Manoj, I hope I got that right. What is the progress of the new Somerville High School building opening?
The high school construction is wrapping up in December, and we'll be turning it over to the public schools in December. Now, there still are a number of logistical things that SPS is going to have to do once that building is vacated by the construction workers. There's going to be a lot of furniture rearranging, and as Mary said on a number of occasions, we have to determine which grades are going to go in there and how we utilize that building. And all the stickers that you saw in the other buildings for directional flows through stairwells to make sure we have social distancing in the corridors, the SPS is still going to have to do all of that. So given the amount of work that the construction crew has to do, and then the logistics thereafter. I wouldn't anticipate that coming on before winter break.
And Rich, just a reminder that the auditorium would follow after phase 1 and 2. So that is estimated sometime in January.
That's a renovation to one of the original wings. We encountered structural deficiencies from the 1900s in that. So the auditorium was always going to lag behind. I also have to confess that the gymnasium is going to lag behind. We're going to try as best we can to get that done by end of December to turn it over at the same time. But there's additional leveling on that floor that has to be done now, and that's an intricate process.
Thanks. From Brendan, if we're not bringing some buildings online until April, and even then at only 2 days a week, is there some consideration to just not even bother bringing them back for what might amount to 10 days of in-person?
Well, from the HVAC upgrade standpoint, we're going full steam ahead on the buildings that we can do these upgrades to. Because one doesn't know how long the pandemic is going to last, and we want these to be resilient buildings. A lot of the centralized upgrades are good things to do anyway. So I don't think we're going to let our foot off the gas on that. And as soon as we have, again, the work plans that we're currently working on, get us through, Kennedy and Winter Hill, we'll then immediately turn our attention to the other buildings in the portfolio, the Brown, the Edgerly, and frankly, the municipal buildings that will require, more extensive renovations. We're going to start planning all that out and seeing where we go or where we need to go to make sure all of our buildings are healthy.
Mary, did you want to add to that at all? You're muted.
Yeah, I just want to say that, we are really hoping that we can get more of the buildings back. Even if it means foregoing a few of them for the year so that we can bring the populations back, the students back. I mean, at this point, we want to think about kids, not just buildings. So that's the goal. And I think if we can get, students back, even if it's for 4 months in person for a couple of days a week, there's that, that's advantageous for all the reasons that we know. So we're just hoping to be able to keep you informed. And we're certainly not going to have any hold up. We're going to be ready to go. So as soon as the assets turned over, we will have a plan for that building. I know Rich and his team are working incredibly hard, and they will continue to do that. There's no bigger priority right now than getting the students back into school.
Kaylin Makins, when we move to hybrid in-person learning, what will the remote learning days look like for the students on the days they don't go to school in person?
So this is something that we're working actively with the union on right now. We had a wonderful collaboration in the remote learning, and I think that has really paid off in the quality of the remote learning. We worked very hard on that so that we have some of that template already as we think about hybrid and we think about what those remote days could look like. So our hope is that it's not going to be too dissimilar to what they're experiencing now. It may not be directly with their teacher. It may be with other adult support staff, but that is something that we are working actively on.
This is from Nai Padilla. A parent asked this question. This parent said, I have 4 kids, one who goes to the high school, and that high school student is asking if the library, I believe the central library, will be open because the house is too small and he can't concentrate on his studies and wants to be able to find a quiet space in the library, it appears. Which this is a building issue in terms of library, probably for you.
Yeah, so the library, along with the other municipal buildings, are what we will turn our attention to as soon as we figure out the Kennedy and the Winter Hill. As it currently sits right now, that building does not have sufficient air handling to open it. So we'll start planning upgrades to that to open the central library.
In the West Somerville Library, I believe is a follow-up to that.
Yeah, so the West, unfortunately, as it was currently designed, because part of it was a renovation and part of it was a new addition, we don't have the air handling throughout that entire building. We're actually meeting with the architects and their MEPs next week to see what we can do to retrofit that. I think likely a mix of doing some additional upgrades to that system, and also putting in-room units will get us there, but that's to be determined. I'm going to try to get that one online as soon as possible, because I think we're a little bit closer with that one than we are with the central.
Go ahead, Mary, I'm sorry.
No, that's okay. This is actually an active conversation that we're having with high school staff, recognizing that there will be students, who just don't have a home situation. It's either, very busy or too tiny, or the internet is not great. And so this will be something that once we get the high school asset online in January, we could potentially look at some learning pods. In other words, being able to set up so students have the ability to come and work there. Even if they're not attending classes, they're still doing their classes remote. So there will be more to come on that. I do appreciate that question. And I know Mr. Lagambina has registered that to continue our conversation on how we can support the high school students.
Andrea Trevilla, will the hybrid have two different teachers, i.e. one teacher for in-classroom and one teacher for remote days?
So this, again, is something we're working with our union on. Right now, what we're talking about is that it would be the same teacher, but that there would be other adults that would support on the remote days, which could be specialists, which could be service providers, which could be paraprofessionals or instructional aides, but not primarily the teacher. So there'll be more information to come on that as we make a little bit more headway over the next week or so on the hybrid.
From Christy, will all family students be attending the same school?
So as it stands right now, in terms of bringing in phases 2A, 2B, and 3C, the possibility is no on that we wouldn't necessarily be able to accommodate that. I think as we go forward and we bring the other grades back, we will do our best to try to do that. We just not knowing yet what we have for additional building assets limits us a little bit in knowing how many of the other grades we would be able to bring back. But we will do our best to try to get siblings where possible to be together, if nothing else, to at least be on the same schedule if they are in two separate buildings.
Greer Goodman, would the learning centers for IEPs be during the school day or in addition to the school day?
So Director Trevisoni, you can weigh in as well. I'll give my 2-cent vision. I would say could potentially be both. I think the goal with the learning centers is to have students be able to receive services and get supports. And so that may work for students during the school day, but if their schedule prohibits that, we may also be able to arrange that as something that takes place after school. Director Trevisoni?
We would definitely be holding them during the school day, and as well as any services that we provide. But if we are able to provide some extra support after school, then we will do that as well. But I think services on the IEP would be provided during the school day.
This is from Tanti. Considering that not so successful school openings of other cities and towns, and in the increase of COVID cases, do you think it is a good idea to reopen Somerville schools? Channy, I think give it the question, I think you hit the answer right on the head, if it's safe. And the best way we can influence the safety or promote that is by influence from the internal factors on the operational side, and all the safety measures are put in place, elevating our HVAC and air filtration systems, and the investment we're going to make there to make that happen, to mitigate the risk of transmission from person to person, and surveillance testing. Every school district should have that opportunity to do those things to provide a safe environment. It is true, we'll have to continue to monitor the collection of external factors and indicators around the community, the region, which may dictate how we have to proceed, whether it's schools or our economic sectors or any activities in our lives. But our goal here is to place the schools on track to begin in-person learning as the external factors allow. Thank you for that question.
Mayor, I would also say that one place that parents can really partner with us on this is working actively with students around mask wearing now, so that they're used to it and they see it as part of what they do. We are developing social stories that students can use at different ages around COVID testing, so that it doesn't frighten them and they're not afraid of the test, but that they see the test, they'll know what to experience, to what to expect, and that it can be an okay experience. Because I think there's a lot of words out there associated with COVID testing that can cause anybody to be afraid. Similar with vaccines, I think it's the same thing, you know, that yes, it's a shot, but that shot is really protecting you and allowing you to go to school so that everybody else is safe in addition to you. So I think the more that parents can have these conversations, whether, you know, it's at a meal or whether it's just, you know, together when you're together as a family, I think that will help students in their transition back to us in school.
Thank you. This may have been answered, but it's asked again for Michael. If we could just answer it again for UNIDO students for grades 3 and 4, which group will they be placed in?
So that we don't have an answer to that yet, because we're waiting to see on East Somerville and on the other building assets when they'll come online. So we have not yet come up with the firm plan for grades 3 and 4 and for UNIDOs.
This is from Andrea. There are ways we can help families in our community who are home insecure. First, thank you for that offer. There are a lot of people who are stretched to the max, who are in desperate need of help. And now that an eviction moratorium was lifted, allowed to expire by the governor and the legislature, notwithstanding the great efforts of our state delegation, and resources aren't coming directly to families and small business from the federal government at this time. So what I will ask, maybe Sarah to do, is someone to put up maybe a link to the Office of Housing Stability and Ellen Schachter. That's the city agency helping those families and individuals in desperate need of housing or facing eviction. And once again, Andrea, thank you very much, because there are many families in need. We appreciate that. Going to go back to the engineering and capitals infrastructure side. An HVAC question from Holly Wasilowski Samuelson. Have you considered temporary solutions to meet your goals of four air changes per hour and 6 filters per hour with strategies like box fans and windows and portable air cleaners, and possibly portable heaters if needed to comfort? Have you considered upper UV germicidal irradiation or only induct UVGI?
So a lot of the part of the solution is the in-room filtration units. So that is actually part of the plan for almost all of the spaces. The trouble with windows and box fans is that it is highly dependent on prevailing wind directions, and you can't really guarantee that you're getting the air exchange that you want or need. So, you know, it was something that we considered along the line, but dismissed due to sort of the reliability and the quantifiability of sort of that bootstrap approach. We do have a number of other solutions that are in there, including some ideas to help reduce cleaning and maintenance, including UV area disinfection, you know, to supplement sort of the chemical and screening. So that there are a whole litany of things that we're looking at. Some of the limitations on that is, frankly, right now, the availability of the units. The lead time from the manufacturers on some of these things are beyond what our timeframes are. So we're also looking at it from that direction.
Thanks, Rich. From Roxana, could you share the slides from this meeting to all of us? Absolutely. We're going to put the link up on the chat function, but in case you don't see it, it'll be in the virtual town hall section of the city's website, the virtual town hall page. It'll be available for you. And again, feel free to follow up with questions or comments to us after you've had another look at it. We appreciate that. Again, I want to take a few more questions. I know we're going past even the latest deadline, I said, but I think it's important we try to get as many questions as possible. For those families, from James Demchenko, for those families that don't believe in vaccines, how will Somerville School District protect their children who do have their children vaccinated? Doug and others?
So we, similar to what the governor's orders are, is that you can have a medical exemption, but all others would then need to be vaccinated. So you'll have to follow the governor's orders for all of those types of issues.
Excuse me, if a student, and this is for, it doesn't say the name, Lumine IDSC, if a student with special needs decides to stay remote, will they still be able to have walk-in services?
Excellent question. Dr. Trevisoni.
When we are able to provide learning centers, they would have walk-in services that we would not be providing walk-in services currently during the hybrid model.
Thank you for that question. I'm going to take a few more here. Might as well round it off appropriately. There are a few people who did not have a chance to have their ask questions. From Mayreed, if I'm pronouncing correctly, and the question is a comment. Hello, I was wondering, can you break down the age groups of the 158 active COVID cases in Somerville? It would be helpful to know how many children are currently affected. Thanks. Doug?
Sure, I don't have that data right in front of me. However, if you do go into the city's website and go to our dashboard, you'll be able to pull all of that information up, and we update that regularly where you'll be able to find all of that information. It also has historical data that be available in there as well. So I would encourage you to look at that and be able to really navigate through that.
Thanks. From Rahul Bhargava. Thank you, Rahul. Do we have any information from the contact tracing program? We need that guidance to assess risk levels of activities. How many cases are from family unmasked gatherings? How many are from tradespeople coming into our homes, etc.? Please release this info to help us make decisions about what to do. Thank you, Rahul, Doug, and others.
Great, thank you for that question. And I can also ask Amy Dr. Bentham to also look at that. We are actually putting together a dashboard for our contact tracing programs that we've started here in Somerville. One of the things that we are looking at, though, within the whole state, when we're looking at the contact tracing program across the Commonwealth, they actually have been doing a little bit of data and researching. One of the things in the largest population that we're seeing of where the virus is being transmitted is actually in those small familiar gatherings that are occurring. That's why we need to encourage people that even when you're with people that you know and friends and families, continue to follow those public health practices of wearing a mask across your nose and mouth, as well as your social distancing. It's a critical part for that because that is where we're finding many of our transmissions occurring currently.
Yeah, just to echo what Doug said, early in the pandemic, super spreader events were very much part of the drivers. And as Doug mentioned, much more small family gatherings driving transmission now. We are setting up a Somerville COVID contact tracing team to continue the great work that the contact tracers have been doing since the spring, very Somerville specific. And a key piece of that will be a dashboard that communicates the success of the contact tracing program and slowing the spread and identifying the exposure origins so we can share that information with the community, which is incredibly important that everyone knows the origin of transmission.
Thanks. We're going to take these last three questions. From James Z first. My son has severe ADD, ADHD, and cannot learn in a remote environment, and as such is failing his 10th grade class. What priority preference for in-person learning will special needs students be given? He cannot sit and watch an hour-long lecture and be expected to excel. Thank you. Thank you, James, for the question.
It's a great question. Chris, do you want to start with it?
Sure. Yeah, we realize that it's difficult for a lot of students, and a lot of students are actually doing very well. So those are the students that we're identifying. We're working with our special educators and our department heads and facilitators to determine who are the students that are really struggling with accessing, and how can we target them for our learning centers And in another phase, when we're able to bring more students back, that we identify who are really struggling to access the curriculum.
That's right. And Principal Lagambina, I don't know if you want to just explain, but to reach out to guidance.
Yeah, but I would just reiterate exactly what Christine said. You know, we will have attention on those students that are struggling, like this student here, but definitely work with their school counselor and liaison, and make sure that, I'm sure they're already informed of the situation, and that information will be used to determine when we can get the student back. But please be in contact with the liaison and school counselor, and we'll do whatever we can to support the child.
These are the last two questions, one from Kim in two parts regarding flu vaccine. Regarding the flu vaccine, per the slides, the students have to get one before they go back in person learning or December 31st. And if they don't want to get the flu vaccine by 12/31, but want to wait until they return to school, will we be unable to continue with hybrid learning in the public schools?
Thanks for that question. That's actually an important question to answer. Students have to be vaccinated before they come back into in-person learning. All students, according to the governor's governor's order, is that all students have to be vaccinated before 12/31 of this year, regardless if you're an hybrid, remote learner, or any other type of learner, except for students who are homeschooled. All other students, and that includes our college-age students, need to be vaccinated before 12/31 at the latest. Currently, if you're going back into the classroom, you would need to be vaccinated before you go back into the classroom.
Thanks for that question. I just want to read the last one. I lost it, and this will be, it's from Julie Engel. Is there anything that parents on this call can do to help support all the people on this call who are clearly dedicating a remarkable amount of time and effort to making our children get back to school safely? Thank you, Julie. I'll have Mary and others comment on it, but we appreciate, and we definitely need everyone's help and cooperation.
I would just say the fact you asked it goes so far. So thank you so much. I mean, honestly, our staff is incredible, and the city staff, and to recognize that is huge. I just think for parents, being able to just have conversations with students as you start to think about, what to expect, everything from the 6 feet, that school will feel different, the masks, making sure that they have their vaccinations, making sure that, you talk with them about what COVID testing's like. These are just all the things that will help their transition be easier, and therefore the educators' transitions easier. But thank you very much for that comment and question.
Thank you. And thank you all of you who've tuned in via the Zoom, via Zoom or YouTube Live, everyone, all the panelists, presenters, everyone on the school and city side, all of you in the community who are doing all you can to help combat COVID. We are acutely aware and understand this crisis has really turned our lives upside down, and there's an unmeasured toll right now, we won't know for a while, on kids. And we're going to do everything we can to make sure our kids get back to school and they have the learning that they deserve and they need. We're going to make sure it's safe. There's so much we don't know about this pathogen, and we're learning from lessons around the country and around the world every day. We want to be responsible. We want to be informed. Whether you agree with us or not, we appreciate your comments and your input, and we're going to work with you. And we'll make all the reports available as they become available to us, and they'll be happening soon. And we'll be scheduling another meeting to update you in a few weeks. Stay tuned, and if you didn't get your question answered, shoot us an email. If you have further comments or questions, reach out to us. Stay safe, stay healthy, and we'll see you all again soon. Thank you. Thank you, folks.